Good afternoon, everyone, and welcome to the Pearson Center. Today, as we have done for many weeks ever since COVID began, we're doing these virtual series of webinars, and we're picking hot topics that we think everybody's talking about. And lately, a lot of people are talking about election or no election. But in the spirit of eventually we're going to have one, we think it's time to start talking about budgets and the focus of governments and their budget. And to that end, we think seniors, that we're hearing an awful lot about thanks to this COVID pandemic, seniors are a big part of what we believe a focus of government. And we want your views on that. So today, we're delighted to address this big issue. We're saying, should seniors care be in the federal budget, which is largely expected to be next month? We know that there have been challenges in seniors' care. Perhaps the pandemic has just exacerbated what was there under the surface in any event. We've got a new report that's published. It's called A National Standards for Seniors Care, and it's written by our senior fellow, Terrance Hunsley, who's joining us on our panel. I want to take a moment to thank our two sponsors for the report and, of course, for this webinar today, and that is the Congress, the Canadian Labour Congress, and the Ontario Nurses Association. And a special thanks to both sponsors. Without this, we can't do this kind of great work. The format for today is going to be a discussion for about 45 minutes with just a terrific panel that we have today. And then the last 15 minutes, we're going to ask for your questions. You'll see the chat box on the screen here, so do direct your questions there. We have a host today that you all know likely already, Andrew Cardozo, the president of Pearson Center, and he's going to be managing the moderating for this session as well as the Q&A of our panelists. So let's get started. Dr. Samir Sinha, who you can see on our screen, he's a regular commentator on CBC TV as well as other media. He's the director of geriatrics at Mount Sinai and UHN hospitals in Toronto, and we're delighted that he's joining us today. Shirlee Sharkey, who I've known for many years, is the CEO of St. Elizabeth's Society, a well-known nursing organization that is contributing and really committed for years to seniors' lifestyle and family caregiving to impact how people live and age at home. We're delighted to have Pat Carr here joining us. She's the Ontario Nurses Association Labor Relations Manager, with a big focus on seniors care. And Pat, we're delighted that you're here today. And Terrance Hunsley, who I've just mentioned earlier, a senior fellow with us here at the Pearson Center and a researcher and author of the report on seniors care that you're going to be able to find on our website. So I hope you'll go down there and see that. Andrew Cardozo, over to you. I hope you have a great session today.
Thank you, Sandra. And what I'll do is turn straight over to Terrance Hunsley, who's done a report for us on seniors care. What we'll do is hear from Terrance about this report, and then we'll engage with the rest of the panel. So, Terrance, over to you.
Okay, thanks, Andrew. I will do a 5-minute flyover of the paper and begin by acknowledging the obvious, which is that the pandemic exposed what was an inadequate service system that had resulted from insufficient funding, from regulatory negligence, and from exploitive working conditions in some situations in the care industry. And not only is there a need for major improvements in the current systems, but the need for care services is going to triple over the next 30 years. And even that is likely an underestimate because it does not factor in any long-term effects from COVID, and it assumes that present levels of informal care from families and friends will also triple. This is an area of primarily provincial responsibility, and there's been a mountain of analysis and expert advice that has been directed rather futilely, I will say, at provincial governments. But the federal government has also been derelict in its judiciary and its constitutional responsibilities, and that's the focus of the recommendations in the report. So given that the Medicare system, the centerpiece of our national pride, was built on federal promises to assist provinces to develop high-quality services meeting national standards, and to do so by sharing equally in healthcare costs, the paper suggests that we should get back to doing exactly that. I did make a rough calculation. by adding current federal contributions to provincial costs through the Canada Health transfer. The value of the tax points that were transferred to provincial governments to support those costs as well, and as well as direct federal contributions to healthcare through other mechanisms such as Indigenous Health Services, Veterans Health Services, federal health-related agencies, research support, and tax credits either for private spending or for insurance. And it still left us with an annual deficit of about $20 billion. And that's the recommended amount then for the increase in federal contributions. Now, that's a substantial amount, and we believe that with that amount indexed to the overall increase in health spending, it would be possible for the federal government to achieve three important improvements that they have been talking about for some time. One is some form of pharmacare, another is improvement in mental health services, and the third being a commitment to improvements in the whole field of continuing care, including long-term care. Now, if those who read the report will note that when we talk about a standard, we do not word it in relation to specific hours of service by specific professions or for specific conditions. That approach has really not been very successful in the past, and in many cases, federal provincial governments have not been able to agree even on benchmark indicators. So instead, we word the standard as a commitment directly to Canadians, whether they're seeking care, receiving care, or providing care. And the measurement is an annual Statistics Canada survey of their experience. The commitment is also that anyone who becomes dependent on care will have access to affordable, high-quality care, regardless of where it's delivered. And every person over the age of 75 will be proactively contacted annually to be provided information on care services and, if appropriate, to initiate care planning. We point out that there is as well, though, in the health and aging literature, a very wide recognition of a need to take a broader, a more holistic approach to maintaining and improving health in an aging society. We need a broader approach to age than what we see in kind of siloed health bureaucracies. And in our view, it means that we have to get communities to be active partners in planning and organizing care, as well as the broad range of community and neighborhood support systems that are so important in an aging society. So the paper also calls on the federal government to encourage municipalities and community associations to develop new initiatives to provide community support, social support programs, and to envision community-centered service provision. This kind of involvement can encompass the availability of care services in the community, combining care with nonprofit and cooperative forms of accommodation, and co-locating these services with other community resources, other community institutions, and services. And finally, just to end here, but everyone, of course, comes to the question of costs. One of the things we wanted to point out, and I want to thank Linda Shui, who's one of the people who responded to the paper, for pointing it out, is that for the most part, the senior population in Canada is made up of healthy, active people enjoying their retirement and senior years and contributing to their community, both in realistic terms and social terms and in financial terms, both the economy and tax revenues of government. Nonetheless, the costs of continuing care are going to rise rapidly, and governments need to plan now to increase their revenues. And we suggest a more progressive income tax on top earners, as well as a tax on wealth, including estate taxes as a contribution to that cost. And I think I'll end now, Andrew. Thank you very much, and I really look forward to comments and advice from the panel.
Thank you, Terrance. And I'll just remind the audience that the report is available on our website, which is thepearsoncentre.ca. And do send us your comments. We're glad to add that to the conversation that's happening on our website. Dr. Sinha, I want to start with you. There's two things I want to ask you at the same time. One is, where are we at in terms of COVID with regards to the seniors population? And flowing from that, what do you think the federal government should be doing with regards to seniors care? And I asked this question, I also want to mention the timing of today is because of the federal budget coming down in a month or so. The finance minister is conducting hearings, or input rather, for which there's a deadline of next Friday. So we wanted to get this session in today, generate discussion. We will send this video in as part of the input, but certainly encourage viewers to write into the finance minister as well. So Dr. Sinha, your thoughts.
No, thank you, Andrew, and Terrance, thank you just for giving the overlay of the report, because I think what we've realized is we all know that we're an aging population, and just to put that into context, within 10 years from now, 1 in 4 Canadians will actually be an older Canadian, so we'll be 65 or better, as I like to say. And just as Terrance was noting, is that when we think about reaching the age of 65, we have about 20 years of life expectancy ahead of us. That's good, and with that, most of those years are going to be in relatively good health. And 93% of older Canadians are living independently in their own communities. And if you ask anybody, they want to stay in their homes for as long as possible. Shirlee knows that better than anyone through the work that she leads. And so, this is kind of, these have been longstanding desires, and these are known things going in. And I don't think a lot of people appreciate kind of what care looks like, home and community, all the way to what we'd call long-term care or nursing home care, because not many of us experience it unless we are one of the 7% of older Canadians who live in a long-term care setting, if you will, a retirement home or a nursing home, or if we have a loved one there. But I think really what this pandemic has shown is a few things. This is a pandemic that's been exceedingly cruel to older people. 96% of Canada's deaths have occurred amongst older adults. If you go back to the Spanish influenza, it was actually exceedingly cruel to young people. If you actually look back at what happened during that pandemic, it was actually older people rescuing younger people, protecting them and keeping them alive. But we haven't really seen the reciprocation this time around, because not only have 96% of our deaths in Canada been amongst those 60 and older, about 70% of our deaths to date have occurred in long-term care settings, so nursing homes or retirement homes, if you will. And I think it's really exposed the fact that we set a system up really to fail. And I think, as Terrance was saying, you go back to our beloved Medicare and our Medical Care Act of 1966, we included hospitals and physician services. We never included pharmacare. We never included long-term care writ large that would include that full continuum of care. And so by leaving it to the provinces and territories, up to their own devices, the challenge is we have 13 different systems of long-term care across the country. They all kind of have their own standards, their own qualifying criteria, what's covered, what's not covered, what's in the basket, how it's funded. Some provinces are more generous and progressive with their funding, others less so. And so you really see this patchwork quilt and the situation where we have a system that's grossly underfunded. 1/3 of our, we spend 1/3 less than the average OECD nation on the provision of long-term care. And the majority of what we spend is on institutionalizing people. But when you look at how we spend so little on these settings, unlike our well-funded, and I'm sure my colleagues, I'm sure Pat will say, well, how well-funded is our hospital sector? But I'm saying, comparatively speaking, and I think I have Shirlee here to back me up, but I always say the further you walk away from a hospital as a nurse, for example, or a personal support worker, the lower your salary gets. And we talk about the low-waged personal support workers or nurses in long-term care homes. Well, Shirlee will tell you, you walk out into the community and you do home care and your salary is even lower to date. So we have a system that really has cut corners in many ways, that's kind of gotten away with things, makes a headline here or there. But now it's number one on the national conscious. And I think number one, you have what the pandemic has done to seniors so far, what it will continue to do. And we still have a few unknowns with the COVID variants that are afoot now. We're hoping the vaccine will be truly effective in these older populations. But we have close to 9 million older adults who need to get vaccinated before we see kind of an end to the carnage that's occurred. So there's a lot of things that have been opened up, and I think this is why it's been interesting when you look at the Prime Minister's mandate letters. What are the top two things that were written in amongst other mandates? One, developing national long-term care standards, and number two, helping seniors to stay in their own homes, and healthy for as long as possible. What does that mean? What does that involve? I think we're going to chat a little bit more about that and build on Terrance's comments. So I'm going to stop there.
Great, thanks so much. Shirlee Sharkey, let me ask you, you were very kind to spend some time with Terrance as he was doing his report. What are your thoughts about where we are today? You're muted.
Great, thanks. So a number of thoughts. First one, unmute myself.
Famous line in all webinars. We're going to do it.
Exactly. But I think it's always a challenge when we talk about the aging population and we fragment it into the remit of our healthcare sector. When, I always now start with how are we addressing the future of aging, which means how are we addressing, and Samir, to your point, all of us, we are the future of aging. It's not a separate subcategory on its own. So how do we actually value all of us? And are we, and I think Terrance at the end, you spoke to this, are we looking at a new way of imagining aging as an opportunity for our society, both economically, from a societal point of view, culturally, all of the above? Or do we come at it with this deficit-based healthcare remit that we need care and services, and then we even slice that out to just hospital care and institutional care, versus stepping right back? And I actually think with the concept, how do we keep seniors where they want to be in their home environment? And then we work with that to all of the other components of our system, and then the healthcare system. That's when we'll actually begin to stop, I think, this loop of conversation that we've had now for almost 30 years of changing things up and doing things differently. I think fundamentally, and Samir, you are absolutely right, the minute anything moves away from the acute care system in the hospital, it is less, which suggests from a valuing point of view, less. So all of our workforce issues, our funding issues, what's happened in long-term care, fundamentally, it is I think, a valuing beginning point where we think less of, quite frankly, the aging population. And I think we need a new, I call it economic narrative, that actually talks about the value of the future of aging in a completely different way. And in the context of that, yes, it is about funding at the federal level. It is about ensuring that that funding is going into a much broader concept than just continuing care, for sure. But I would call it all of life care that seniors require, because it's the investment that we need to bring into the seniors population that will give us the return on that from a new value proposition. So it's a very different starting point. And in fact, if we continue this, crisis mode change in intervention, whether we tried to do it in home care, weren't successful. Now we're falling into the same category with continuing care and long-term care, just slicing it out and being very myopic. I actually think will cause more damage and more delay to move forward. So fundamentally, there doesn't need to be more funding for seniors, but even more so, right now only 90% goes to hospitals and institutional care, 10% to everything else of how people live their lives. It has to be at least 30 to 35% in that other category. But the pie also has to get bigger because there will be a return on that investment. So I think at the federal level, certainly the standard and declaring is a very good starting point. There has to simply be more funding, but also the control of where those resources are put. If it goes right back into the acute and right back into the long-term care bricks and mortar, we will not get out of this loop of despair.
Yeah. Thank you, Shirley. Pat Carr, I want to ask you your thoughts. Your members are nurses on the front lines. What are your thoughts?
Well, as I listen to Samir and Shirley talk, one of our biggest concerns is about being able to return nurses, RPNs, DSWs, NPs into the workforce when the dust settles with all of this. The frustration I hear in Shirley with the rates of pay and home care, the working conditions, it's what our members tell us on a regular basis. We have had numerous conversations with our long-term care nurses in tears in preparation for the long-term care commission with the total devastation in long-term care. Even hospital nurses going in to assist in these settings are amazed, surprised, distraught at the setting. They didn't understand that their sister nurses worked in such conditions, or that they gave the level of care that they actually do with limited resources in these homes. Shirley's right, there has to be more money to go into the system to not only upgrade these facilities and ensure that we've got proper HVAC systems, proper IPAC controls, proper training. We have to have staff paid at a level that they will continue to work in the areas they love with the people they love to deliver services for, whether that be in their homes, in the community, or in a long-term care facility. It has to be where the need is the greatest.
Yeah, one of the things you mentioned, Pat, supporting the people who work with the people they love. I find that such an important point that we forget. Just to give you a quick example, I have a close relative in a retirement residence, and one of the things I note is at meal times, the people who are serving, the servers who serve the residents their meals, not only provide their meals, they shower them with love and kindness as they're doing it in a lot of respect. So they know all their individual names, they know their likes and dislikes, each one of them, and make sure they get the meal they like, and they call them love and dear and darling, and they just provide a lot of love to people at the high point of each day, which is the meals oftentimes. And yet these are the lowest paid people, often earning just the minimum wage or a touch over that. How do we get people to think about putting more money into that, Pat? Does that come from government? Does it come from people who live in residences or are getting services in their homes?
The pot has to start from government. They're the ones who have the funds to reallocate into these areas. But we need to continue to encourage the type of individuals that are going to value the stories, the lifelong lessons that we're hearing from our seniors, and to make them continue to feel like a valued part of our society. They're the ones who are still often working when we don't have younger people in the workplace, because our younger people move on to different professions. They need other challenges. It is our seniors working beyond age 65 that need to be valued for the opinions they have and the feelings that they have. They are still useful parts of society. We cannot just shut off that line of communication at a specific age. We need to encourage those conversations.
And I want to build a bit, if you will, on like what Pat and Shirley were saying, because I think if we, I think the challenges, and I agree with Shirley that, we've always talked about this care paradigm and just tried to say if we can just do it more efficiently, then that's the solution. And I think people then realized, I think a decade ago, maybe we should change the entire system. But then that's kind of hard because it's very political to do so. And I've certainly kind of adopted this philosophy, especially when I try and lobby via the Minister of Finance as opposed to the Minister of Health about this is an economic, imperative, and for a few different reasons, right? So number one is what people don't like to talk about is like how to your question, Andrew, like who pays for this, right? Well, the challenge is if we say, okay, well, if seniors want to stay at home, if an older person wants to age at home, well, they should just buy extra home care. They should invest more money. Well, here's a little secret that people don't really know very well. The average older person, for example, who's retiring without a workplace pension plan, so we're not talking about CPP, old age security, GIS. So in our papers last year through the National Institute on Aging on the future of long-term care, we showed this one beautiful stat, or it's actually a rather sad stat, which was basically showing that the average person retiring without a workplace pension plan, so that's about 2/3 to 3/4 of people who are retiring now, only have about $3,500 in the bank. That ain't going to get you a lot of private home care. That's not going to get you a lot of options, period. And even if you look in Ontario nursing homes right now, 1/3 of the residents in these homes can't even afford the basic copay that they would. So we really have a lot of people who can't afford to age despite, what we're spending on care, number one. So when people say, well, we should just get them to pony up more money and pay for the cost, well, it's a bit of a fallacy to think that that's what's going to happen, because we haven't enabled people to age with financial security to really make their own independent options. They really are reliant on a system that we've allowed to develop over the last 50 years, which isn't really setting people up for success, and hence this huge reliance on institutionalization, which is costly. But I want also, to Shirley's point as well, is we often don't think about the financial, the gains that we have. So I think people are now getting this around childcare, right? So when we actually fund childcare in Quebec also has the highest female labor participation in the world, right? And now Newfoundland has just actually committed to creating, more childcare spaces, because we realize when we allow women the option, that we can create affordable childcare, for example, it is a huge incentive and it spurs on economic productivity. What you pay on childcare, as a government is nothing compared to, for example, the economic benefits you have with more women being able to participate in the labor force. We forget often the economic benefits that we have from people living 20 more years beyond 65. They are the largest provider of unpaid care in Canada, right? And that's often because it's spouses caring for partners, right? Because again, with you only have $3,500, in the bank, then you're now looking and you're like, okay, who's around me? Okay, Shirley had a grandchild. That's an investment in her future, right? All of a sudden, you start looking around who can provide that unpaid care. And then number two, also, now that Shirley has a grandchild, and I think I can share that out loud because that was some great news.
For sure.
But all of a sudden, Shirley, I bet your children are kind of like, hey, grandma, want to come on over and provide some unpaid care, to me? And we realize that older Canadians are the largest unpaid care providers, childcare, I would say, and elder care as well. So you're talking about billions upon billions upon billions of dollars. And so these are the economic consequences of not understanding how we need to think about this as an economic productivity issue. Because the more older people stay independent in the community, it costs parts of our expensive healthcare system less. It actually has them living longer, contributing more, because they can never get away from paying taxes until after they die. And it's all those investments. Healthy seniors are healthy contributors in so many other ways that are important. And I think once we get that paradigm around what this really means, we start realizing that actually there is a real case here to say there's actually a real asset to healthy, like a growing older population that's healthy and independent, as opposed to a population that's sick and institutionalized, in an expensive, in an appropriate way, if you will.
Yeah. So, Samir, given that the federal government tends to have more money than the provincial governments, do you think they should be ponying up more money in the upcoming budget?
You know, I think like it's one of these things where, you know, I remember I had the privilege of providing advice to the minister and Health Canada back in around the time of our most recent health accord, and it was particularly around the home care investment, right? I mean, I found it fascinating that because when we actually polled Canadians in 2014-15, you know, Canadians said the number one thing they wanted invested, you know, in actual in healthcare was improving home and community care, which again, you understand why, because they're like, I don't have money to pay for it, and what the government's giving me isn't great. And people were already thinking about aging and the parts of the system that were lacking and what people really wanted. And so you had a bidding war in the last in that 2015 election. You had, you know, the Liberals pledging $3 billion, the NDP pledging $1.8 billion, the Tories saying zero. You know, and I was like, what's going on here? Wait, like, Shirlee, why are federal parties bidding on a provincial and territorial remit? Because frankly, this is what Canadians were saying they wanted, and that's one thing that the federal government does not have a shortage of. It's money, of course. You know, I mean, they make it, they can print it, you know, whatever. The point is, you know, the idea is they were willing to get into that game and play it. But what we saw play out was eventually, you know, the provinces just said, just give us the money, we know what we're doing. And I think Pat, Shirlee, and I would say, I wouldn't go that far to say you know what you're doing. And frankly, one of the clear things the minister at the time and the deputy were saying to me is like, we're happy to give money, but we want to have some accountability. Because frankly, some provinces are spending a lot more than others, but we're not necessarily, I can't really point to a place in Canada where I can say, yes, you know, this is that high quality care that Terrance was talking about. Like, this is achieving that mission. How do we know you're achieving that mission with that $6 billion investment over 10 years. So right now with the conversation about, you know, national long-term care standards, and some provinces saying, we don't need standards, we just need more money, we know what we're doing. I think the statistics that we lead the OECD countries in the most number of deaths in our care settings tells me we shouldn't be that smug. And frankly, if we're going to get the federal government to provide more money, it's got to be tied to some clear metrics, some clear standards, some clear deliverables, so that we can fix long systemic problems that we've allowed to fester.
Yeah. Shirlee, your thoughts on whether the federal government should be investing more in this area in the upcoming budget?
You know, there's no answer to suggest anything but yes. I think that standards are critical, but I think they need to be at the highest level at the federal perspective. And this is where our whole conversation of the aging population and a new way of addressing all of us as Canadians and what we want for Canadians, that's a starting point. The feds, yeah, the simple answer is they have to fund more, they have to print more money, and they have to put it into this area. It's as simple as that. And I mean, it's funny. When I looked at funding, though, it's not only funding for care, it's also incentives, tax incentives. It also is workforce investments, and it also is looking at social finance models. It is multi-pronged. There's no sort of simple bullet, just give us the money. And Samir, you're absolutely right. It's not just give us the money and we know what we're doing. If that was the case, we wouldn't be in the situation that we're in now.
Yeah.
And I do think there needs to be creative ways of looking at this. And it's funny, Samir, when you were talking about a child benefit, some of my thinking is maybe we need a Canadian seniors benefit that looks at aging packages that we've seen in other countries. Australia has, you know, an interesting perspective of senior care with aging packages dealing with finances and also what their care requirements are, where they reach different levels from 1 to 4 levels, and then these are the resources, and then if you have more you can augment, but there's a minimum support, and let's call it for life care. It's not a minimal support for hospital care and medical care, it's for life care for seniors. So it's a whole new way of looking at it. So funding and supporting, and actually I think it needs to be significant funding and resources in this area with a multi-pronged approach to how it is used to shift the loop. We are in I wrote on it, our Groundhog Day loop. And we have to shift that right now. Samir talked about the projections of the aging population. We've been talking about ALC problems, alternate level of care, readmits to emergency room, now long-term care beds and what the issues are. We have been talking about this problem for years and years. This now needs a complete wake up and a multifaceted approach. There have been studies on long-term care and standards and reform and quality. There have been reports on what we need to do with the aging population. I was looking back in 1998, I presented at the national conference looking at modernizing home care, if you can believe it. And actually was looking at it last night to say, what did I say? And at the end I go, now is the time to invest in home care for seniors. We need to move at this. And that was 1998. So now I'm saying once again, now is the time, and there has to be significant resources, but also real, I would say, fiscal design that we are using these resources effectively from all of the incentives I've talked about, from the tax incentives and the workforce investments. And I also think the social finance models could be extremely interesting as we look at new housing and new approaches. So it is really almost breaking apart from this very fragmented remit of everything with seniors is in the healthcare space and looking at it in a very different way. If it is just more money going into long-term care beds because of the crisis we are in, that will be enormously disappointing because we're not only missing an opportunity, we are continuing decades and decades of being behind the 8 ball with how to deal with Canadians. Forget about seniors in the aging, how we value Canadians. It's as complex as that and as simple as that.
So with a federal budget coming up, my sense is, Shirley, you're talking about a longer term reframing of the paradigm, about how we talk about seniors care and the care of others, and Samir's talked about childcare and those benefits. Do you think—
I'm talking about short-term, a huge infusion of money and resources in this space.
Okay.
There's no other cute way to get around it.
Yeah. So the provinces push back on the federal government and say, no, just give us the money. Do you think this is the time, given what is happening, what Samir talked about at the opening, the urgency and the dreadful situation that we're seeing? Do you think this is one of those times in history where the federal government can be more firm and say, no, this is the way it's going to be?
It has to be that way.
Absolutely, and I think they can be broader and looking at it from a health point of view. Sometimes that gets them into a bit of a political quagmire. I think that they could be, as they have, they've talked about the caregiver issues, they've talked about Canadians want to stay in their home. So I think they can begin to use language that enables and reinforces that concept versus locking us into these sort of compartments of this is health and this is this jurisdiction and this is the other. So I think there can be a creative way to be looking at the outcomes and the metrics. Samir had talked about some effective outcome metrics that we can be accountable for. I actually think Terrance's paper, where he talks about contacting people over 75 and seeing how do you feel about things? Are you less fearful about your future? Are you able to remain in the home environment? Those are important questions versus did you have access to the healthcare system? And change up what would be those sort of directives and responsibilities. I think we need a new way of looking at this because we are stuck in a groundhog loop. We are truly stuck.
Just quickly, Samir and Pat, your thoughts about how giving the federal government some more spine on this issue or determination?
I think there's, a few things. One is we definitely need an investment, but if I was, speaking to the Minister of Finance today, I would say do not write a blank check for $20 billion to support long-term care in the provinces because it's going to disappear. You have no accountability around it because they're not clearly, like, it didn't happen with home care. It ain't going to happen with long-term care. And frankly, you know, it may get them off your back for a year, but then they're going to come back to you and complain again. So do not do that. Please just hold a check on that one right now. I believe that, you know, if you're going to give money towards, you know, improving healthcare or some aspect of care, like, let's put it that way, you know, with that first piece in Minister Hadju and Minister Schultz, you know, kind of mandates saying you've got to come up with standards. Well, I want money tied to standards, frankly, because frankly, like someone's got to play the dad here, and someone's got to say, okay, this is what you need to do. However, you know, back to what Shirley was saying, there are great policy mechanisms we've learned from around the world that the federal government could provide leadership on today. Because frankly, if you just leave it to the provinces, you know, my view, you know, again, you don't know what they're going to come up with. And frankly, I haven't seen any province that has a great, terrific aging, you know, broad aging strategy. But Shirley mentioned something about the idea of a benefit. And this is one of the things that actually it was a good policy thing that I didn't come up with on my own. And that I was actually sad to see it died in the last Ontario election, because the government of the day looked at something that I had written a while back around the Veterans Independence Program. So it's called the VIP program, and that Veterans Affairs runs. And it literally gives, you know, veterans access to a little bit of funding, not a huge amount, but a little bit of funding that can allow them to age with independence on their own terms in their own homes, i.e. paying for someone to mow the lawn, helping to someone do snow shoveling, housekeeping. It's those little things that are often the straw that breaks the camel's back, and it's a great investment in small business. Frankly, I'm going to pay my neighbor to actually go and shovel my driveway. I'm going to do this or that. It's a great opportunity to allow people to have control, and you're not doing it through the healthcare system. You're not doing it through the hospitals. But you know, the plan in Ontario, the idea was senior households 75 and older have access to this benefit that they can use towards expenses like this that help them stay healthy and independent in their own homes for longer. I would say great opportunity in an election year possibly to throw that one out there, because frankly, I think Shirley, Pat, and I would know that I would trust a 75-year-old to do the right thing with that money than I would a premier any day to say, just give me the money, I'll fix long-term care. That would be a great signature investment, great political platform piece, frankly, and it would actually have a huge amount of effect, because how many people and how many of Shirley's clients across Canada, you know, where she can't necessarily provide that for them, for example, when they may not have that funding in the bank and they're relying on government funded home care that says, oh, that's all fluffy stuff that frankly is not the core of what we should be funding and doing. But Shirley and team know that's often, and frankly, Pat's members know as well, like these are what nurses and physicians, and like we see this all the time saying, if only they had that, that would make it all work.
Yeah, Pat, your quick thought?
Certainly, we do recommend some amendments to the Canada Health Act in the form of an addendum, though not actually amending the act itself, to do exactly as Samir and Shirley are suggesting. Set in place some national standards with attached to it some deliverables that are necessary to ensure that the provinces are meeting those national standards that's tied to the funding. It's the only way we can have accountability for the money that's transferred in to assist in long-term care.
And when you say you're not advocating the amendment of the act, is that just because it takes too long and too complicated?
Very much so. An addendum is much easier to add, that's specific and totally on point with everything we've been talking this last hour about. And we're almost there with some of the discussions that have been had. They need to put that in place and make this change immediately. Retroactively would be nice, but that's not realistic.
Yeah. Okay, we've got a number of questions coming in from the audience, so I'll try and go through those quickly and just point them to each of you. Samir, maybe you can answer this one. What countries have best practice for seniors care, and what do they do that makes them the best? How do they pay?
Yeah, no, it's a great question. I mean, so again, I don't think any country has nailed it or got it perfect, but I think there's several countries where they're leading examples. And I think Shirley already mentioned Australia, that has a much better well-defined social contract that tells people what your lifetime contribution should be towards your care, whatever that care will look like, whether it be in a long-term care home or in the community. It creates great transparency, and it allows people to understand and have a more transparent way to approach a very uncertain period of your life. That's number one. There are some countries that have good social insurance models, right? So the idea that, you are paying in to a system that, will be there for you depending on what care you will need. And my favorite country that people know I'm completely unbiased, or I'm completely biased around, is Denmark, because I think they've gotten most of these things done well. For example, they have a real system that where Shirlee was talking about what should they spend beyond the hospital. Well, in Denmark, in the area of long-term care or seniors care, if you want to call it that, 2/3 of their spending is based around supporting people to live in the community. Only 1/3 in institutions, if you will. That's compared to 87 cents on the dollar in Canada to be institutional for institutional care versus 13 cents. So a real different paradigm shift that's worked well. And back to that notion of what Terrance was saying, at 75, you've got a public health nurse that comes around not just to do well baby visits, but also healthy senior visits, right? Do you know about the senior center down the way? Do you know about your tax credit? Do you know about this? Do you know about these home adaptations? And it really allows people to feel that that people are supporting them to stay healthy and independent for as long as possible. And it's been great economic policy for that country. So those are just some of the ones that I look to and around the world as some good examples to start.
Hey, thank you. Pat, I'll ask you this question since the ONA is very efficient at advocacy. How can the average person show their support for having high quality seniors care? What can be done politically?
Well, we have a number of initiatives going on dealing with wage restraint legislation is one that addresses the rates of pay across the province for all the different levels of care that are needed to provide equal access to care at all levels, from home care through. Definitely, we have all kinds of links on our ONA.org website to various political individuals for letters, campaigns, various different pieces. We encourage you to involve your local MPPs as well. Write your letters, tell your stories, engage the Long-Term Care Commission, even your family physician with all of your stories, because I think Shirlee and Samir have definitely been very clear. We have the ability to do this. We just need to have the right individuals make the decisions.
Yeah, okay. And I will just remind the audience that the Federal Finance Minister, Chrystia Freeland, is welcoming comments or input for the budget with a deadline of the 19th, which is next Friday. So if you just Google Finance Canada, you'll find the information there. Shirlee, I have a question here for you. Is there a way to create national standards? So how can we deal with seniors housing as part of housing in general? How can we improve seniors housing at the federal government?
I think it's a bigger piece of all of the discussion for seniors care. What we have found, and Samir, you're so right with Denmark, because it's one of my sort of favorite countries, looking at what they have done, because they've actually, when's the last time they built nursing homes? Is it like back in the 80s, based on how they've had a whole different approach. And some of it has been different innovative models of housing. This is where I think the social finance comes into it. And we've actually been looking at a form of sort of the missing middle, to Samir's part, where seniors can't afford the retirement home. They can't necessarily afford it. There's lots of reasons why they don't want to stay in their current home. So are there other designs of communities that we can put in place in a very different way? And again, that's where I think we need to free ourselves out of these silos of health, social, housing, even training and education, and figure out an overarching seniors strategy and an aging strategy that then brings all of these components to almost 1 + 1 = 3, with all of kind of a very different synergistic way of looking at this. So it is a wake-up call for how governments are functioning with the aging population. It's a wake-up call to how we're funding. and an innovative drive, not just in new solutions and products, but a different way of looking at solutions for people, so that they're not home care solutions or hospital solutions. What they are solutions for seniors and what they're requiring and how they're aging. It is, I think, an opportunity for us to actually get very inspired and to change up how we are looking at what has been the burden of aging and the fearfulness of people for aging, to the excitement of real new opportunity.
Are there many apartment buildings which are sort of seniors only buildings?
Yes, there's several senior buildings. There's several new development and design for buildings. What we have to watch, though, is there really is the economics where people, what can we afford and design different forms of housing in different communities. And I do think we're seeing many clusters of smaller settings versus these big, large, high-rise, and other sort of intergenerational models of care and housing. I think, again, we'd be myopic if we just said all the housing people get together and look at a creative way of looking at it. We need people like Samir and organizations and housing and developers all working together, of course, with individuals and their families and what their needs are, to be designing and, quite frankly, have various different models. What I find in healthcare and other areas, we want everything to be consistent and a pathway and linear. When we're looking at different approaches to care for the aging population, it has to be messy, customized, personalized, each community, bottom up, a very different approach to it. And I think that some of this is almost all of us working in the system to kind of free up our group thinking of many things to how we look at this new age and this new population of people. Okay. Money helps us have freedom, but it is not the final ingredient that's going to be required here.
Yep. And Samir, question for you: how do we provide better wages for the support staff in seniors' homes?
I think the key is that I really firmly believe we just need to have wage parity, number one. We have to just basically say that a nurse, a PSW, whatever, you shouldn't be paid by who you choose to work with or support. As Pat was saying, as Shirley was saying, I mean, we're devaluing people by actually paying, the workers less. I mean, very few people went into geriatrics, right? There's only 304 of my type of doctor in Canada out of 84,000, 9 times as many pediatricians, because we didn't value even physicians working with older adults and the way we need to work with older adults in that way. Frankly, we just need wage parity. I would say everybody should make the same wage, if you will. And then frankly, you then don't have this whole situation where you have an unstable labor market, and frankly, people, and people, struggling to actually do. Because I think, as Pat was saying, we've traumatized an entire sector of the workforce. Many people who've left the workforce altogether don't want to go back in, and that's not a way to build, an equitable system. So I think we need wage parity. We need to figure out what is an appropriate living wage for people doing the work that they're doing, and I think that's a start. And then it's not just about paying people better. It's because the pay is one thing, but when you don't actually set people up for success with the right training and the right skill sets, again, we don't mandate geriatric training in medical schools in Canada, not mandated in schools of nursing, right? You getting what I'm saying is that we're preparing an entire legion of healthcare professionals who have no clue how to care for soon 1 in 4 Canadians. Like it's a gong show, right? And this is why, as Shirley was saying, we just need to think this through and hold back. And what I'd like to remind, Minister Freeland and everybody, or any political party out there trying to get some ideas for their platform, is that we have 9 million seniors in Canada. 80% of them vote, frankly. If they all got together and created the Seniors Party of Canada and 80% of them voted, frankly, that's more votes than any of the 3 political parties have ever received in Canada. So you know what? Everybody's starting to pay attention to what this group wants because they're influential. And frankly, either you get ahead of it or they'll get ahead of you. And Shirley's
you're,
going to be the lead of that party. And there you go.
you're mentioning a couple of great political points today, Samir, and they're very timely, of course, because we might well have a federal election in this year sometime. We're running out of time, so I'll ask each of you to make a closing comment, perhaps around either what you'd like to say to the Minister of Finance federally, or otherwise what you'd like to say to the provincial governments, because in a sense, we've kind of let the provincial governments off the hook so far and just said the federal government should just say, do this, but then of course, the provincial governments have a different idea about their role. So Pat, I'll start with you, and I'll go Pat, Shirley, Samir, and then Terrance for a closing comment. So Pat, please go ahead.
The provincial government's got a lot to be accountable for in the way that they've managed the pandemic over the last year. They need clear direction and clear deliverables from the federal government to transfer the necessary funds. Samir has put some dollar figures on it, and so has Terrance in his paper. At the end of the day, the province needs to listen to the federal guidance and meet those standards.
Okay, thank you. Shirley.
Be bold, go big, and go home. I think we've imagined the railroad. Now we have to get busy and build it.
Samir.
Yeah, and part of that going big and going bold is we need to have a national senior strategy. We can't just think about long-term care. We need to think about the future of aging, and the future of aging starts from the day you're born, frankly. So we will benefit as a country if we invest in this. And as I think as Shirley was saying, the return on investment will be huge. It will actually secure our economic future if we actually realize that investing in soon 1 in 4 older Canadians is actually the smart thing to do, and especially making sure that we actually promote this concept of healthy aging. So we need a national senior strategy. We need to have accountability and collaboration with all levels of government, because not one can do it alone. And if you don't get it done well, the seniors will vote you out.
Samir, can you just briefly say a few different aspects of what that strategy should include?
If you go to nationalseniorstrategy.ca, you will see it there. It's basically 4 core pillars: independent, productive, and engaged citizens, healthy and active lives, care closer to home, and support for caregivers. All there, outlined around 4 evidence briefs. The governments, have actually been implementing a lot of our policies and never taking credit for them, whatever. But regardless, it's all there. It's all laid out. We updated it right in time for a potential federal election. So it's all there. And as Shirley was saying, go big or go bold.
Great. And say that URL again, please.
National Seniors Strategy. So nationalseniorsstrategy.ca. And you can see it all there, all publicly accessible.
Excellent, perfect. Terrance, over to you.
Yeah, well, thank you so much to the panel for the wonderful, wonderful comments. I think they're great. I want to make one quick comment at the beginning, and that is that, of course, we do have major programs for seniors, and they're called Old Age Security, Guaranteed Income Supplement, Canada Pension Plan, and others, but just those 3 instruments play a major role in stabilizing many economies across the country. Many communities have their economy stabilized by those expenditures, and so this does not represent a drain on the economy. It represents an investment in the economy. You have pointed out that we need money in the system, and we need substantial money. We don't need nickel and diming to go into the system right now. We need a major investment. We need accountability, and we need that accountability to come back to Canadians. It needs to come to people, and so it needs to be public. And just thirdly, and just picking up on what Shirley said and other 2 agreed on, is that we really need a kind of a social enterprise approach to aging. And that does require some creative thinking, I think, for all of us. But the federal government has done this sort of thing in the past. They invested many years ago in the cooperative movement, and we still have across the country cooperative developments, which are in second and third generation and doing wonderfully well. And that was done by putting some money out and inviting creativity. And that's a good start, I think, for us now in this area.
Okay, thank you, Terrance. I'll just, before I say goodbye and thank our panelists, I just want to remind our audiences that we've got a few webinars coming up next week, rather a heavy week. On February the 16th, we have a session on energy affordability. On February the 18th, we have a session with Minister Mariam Monsef, the Federal Minister for Women and Gender Equality. And on February 19th, we have a session on childcare, which is similar to today. The question will be, should childcare be in the federal budget? So thank you very much, Dr. Samir Sinha, Shirlee Sharkey, and Pat Carr. You each brought a lot of really incredible information to this discussion. We thank you very much. Terrance, congratulations on your paper, and I'm sure we've learned a lot more today. So thanks all, be safe, and look forward to this year of a federal budget and the election that Samir has mentioned. Thanks all.
Bye now.
Bye-bye.